Hi, I'm Mary Alice Haney, and today I'm here with my co-host, Dr. A.
I have family history of dementia, and I'm very excited about this episode.
On today's SHEMD, we have Dr. Kellyanne Niotis, a preventative neurologist and an absolute rock star in the brain health world. She is one of the leading researchers in the field of brain disease prevention, and the findings of her research are going to blow your mind. Stay tuned, this is a very important episode. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SHEMD, some of the products and services we discuss may involve sponsorships or paid advertising. So we are so excited today to have Dr. Kellyanne Niotis. This episode is especially near and dear to my heart because my father has late stage Parkinson's and there's a lot of brain disease in my family. And I actually stalked her and her mentor, Dr. Richard Isaacson, maybe a year and a half ago, just because I got very into thinking about the brain and how I could be preventative and what can I do and my sisters do and my children do so that we don't end up sort of in the same boat that my father is in right now. And I met her, and she is a preventative neurologist, and I can't wait for her to tell everybody what that is. But I also, Kellyanne, thank you so much for being here. And I just want you to give everybody a little bit of your background. And I know I call you and Richard the rock stars of brain neurology, but it's true. You guys are on the forefront, and you're now the preventative neurologist. You're leading the program for Peter Attia, who's another incredible doctor who I have a slight crush on, but don't tell my husband. Can you just tell us a little bit about your background and how you got into this? And really, I think everybody would love to know, what is preventative neurology and the history of it and how you got into it.
Yeah, of course. Well, thanks so much for having me on the show. I'm so excited to talk about this topic. It's something I'm so passionate about sharing with everyone because there's just not a lot of high quality information out there. And I think it's just so important to empower people, especially women, to take ownership of their own health, especially their brain health. And now the world is finally seeing how important this is. And it brings me so much joy to be able to talk about it. So I am the first preventive neurologist. So what do? I see people who have risk factors for various neurodegenerative diseases, Alzheimer's, Parkinson's disease, Lewy body disease, risk factors based on their family history, based on their genetics. And I work with them to try to optimize what they're doing to reduce the risk of developing these diseases later in life and hopefully ultimately prevent them. And the way that I approach things is very individualized and very personalized because I truly believe that one big reason we haven't made major strides in this field is because the disease can be so different depending on the person. In addition to my day job, I also am a brain health researcher. So I am the director of Parkinson's disease and Lewy body prevention research at the Institute of Neurodegenerative Diseases, where I work with my very favorite colleague, Dr. Richard Isaacson. The Elvis to the Madonna.
That's what we call it. The Elvis of brain health. And he's so cute too. He's another crush, but we'll get into that a little bit later.
Basically, I'm a major nerd, and I have been a major nerd my whole life. Love nerdy hobbies, mushroom picking, scuba diving, you name it. So today we're going to just talk about one of my true passions, which is prevention and preventive neurology, preventing these diseases when people are in their 30s, 40s, and 50s, not when they're in their 60s and 70s.
Which is really what we want to do. I mean, on this podcast, it's about giving women the tools and knowledge so that they can own their own health. It's not easy to talk about cancer, yet knowing your family's history of cancer is a first step to understanding your own risk and may qualify you for genetic testing that can help inform your way forward. The MyRisk Hereditary Cancer Test with Risk Score from Myriad Genetics is a powerful tool to help healthcare providers identify your risk of developing 11 different types of hereditary cancer. And Risk Score analyzes multiple factors to estimate your risk of developing breast cancer over the next 5 years and remaining lifetime. Breast cancers can be missed on annual mammograms, especially in women with dense breast tissue. And some patients may benefit from more advanced screenings like an MRI. My Risk with Risk Score can inform decisions about additional screening methods, which may find cancer at its earliest, most treatable stage, or even prevent it. Knowing your cancer risk can be just the beginning of more personalized care. Learn more about My Risk with Risk Score at getmyrisk.com. That's GETMYRISK.com. You want to just sort of talk about the basics? What happens to the brain? Why does this happen? You know, you've done so much research on this with Richard.
Yeah. So before we talk about actual neurodegenerative diseases, I think it's really key for people to understand what happens to the brain as we age. So with age, certain neurological systems will start to naturally decline. Certain parts of the brain will start to shrink, especially those parts that are important for learning, higher order cognitive processes like planning and strategizing and problem solving. Connections between brain cells will become a little less efficient. We can see on brain MRIs, little white spots will form. And what that is damage to the small blood vessels of the brain, which is inhibiting these brain cells from signaling quickly to each other. Blood flow will naturally start to decrease, and inflammation, or so-called inflammaging, starts to occur, which can trigger a whole slew of issues in the brain. When we think about how these changes start to affect someone's cognition, there are certain domains that we see affected. Primarily what I mentioned, problem solving, planning, strategizing, processing. What I mean by that is how long it takes you to respond and interpret what's happening in your environment. A classic example of that is when you feel like, that word is just on the tip of my tongue and I can't get it out. Like, what is that word? What is that word? And then, 20 minutes later, you'll be like, yeah, that's what it was. It was microwave.
So that's normal? So, we all think we're getting dementia when that happens, when we lose our car keys or we... I keep expecting to find my car key in the refrigerator. And then because somebody told me that if that ever happens, you definitely have a problem. So
no, in fact, that's not a problem. Another thing that starts to happen with age is that our attention span starts to decline. Our ability to multitask starts to decline. But everyone is really, really busy. That's one thing I can say is that most people that complain to me about having memory slip-ups, it's usually due to the fact that they're so distracted. They're not actually paying attention. If you can't pay attention to what's in front of you, you are never going to remember it. And people start freaking out and thinking that it's a problem with their actual memory, but in fact, it's not. And what I think is so fascinating about how age naturally starts to impact the brain is that these changes in attention, in processing, in problem solving are the changes that you see, not memory changes. Memory changes are not a part of the normal aging process. The memory lapses that older people will complain about are actually directly due to these other changes I just mentioned. So the actual memory loss is never a normal part of the aging process.
So, first of all, hi, nice to meet you finally. I've heard so much about you. I have so many questions for you because after I went through my breast cancer treatment and I started all these medications, I went through menopause. If you ask me what changed, the first thing I would say is memory. So it's very important. I'm a physician. I see patients, and that's me 24 hours a day. What was this person? What was I? It's at the tip of my tongue, but I can't remember it. So exactly what you said. So why is it? Is it true that 2 out of 3 patients who get diagnosed with brain disease are women? Is it because they go through menopause, something shifts at menopause, or is it something in our DNA? Why is it that women are more affected, and how do we prevent it?
That is $1 million question. As we learn more about women's brains or learning how to take care of women's brains better. So why are women at a higher risk of diseases like Alzheimer's? And what's contributing to that? Is it menopause? Is it hormonal shifts? Is it in our DNA, as you say, on our X chromosome? We've done a lot of research in this area, and what seems to be clear in what we've found is that these rapid changes in hormones that occur during the perimenopausal period seem to trigger neurodegenerative changes in the brain. We know that there are estrogen receptors in the brain, and these are very responsive to peripheral estrogen levels. During menopause, there are these sharp fluctuations in female sex hormones that happen so quickly for women that the brain doesn't really have time to respond or adjust to it. A recent meta-analysis actually looked at using hormone replacement therapy. So there's a lot of controversy. Does hormone replacement therapy cause dementia? Does it cause cancer? Should we use it? Should we not use it? And really what the high level thought is now is that hormone replacement therapy, when given at the appropriate time, so during the perimenopausal period, during someone's 40s or 50s, when they're experiencing these menopausal symptoms, that's when HRT has the best chance to be protective against the brain. So I advocate that women really should be using this, especially if they have symptoms, because these symptoms are due to these rapid fluctuations in female sex hormones.
And as a gynecologist, when you give hormones, the most common complaint you hear from patients is, it's foggy. There's this fog, and that fog lifts when you start them on hormone replacement. But then again, what do? I'm on a medication, anti-estrogen, right? All these, our platform is for breast cancer. A lot of breast cancer patients not only they can't take estrogen, they're on a medication that blocks their estrogens, whatever they have. So hormone replacement is good, but it's not an option for all women. So what else can we do?
Yeah, there are a lot of basic things that we can talk about that all women should do. But I do want to mention before I answer your question that what is really challenging, especially for women who've had to undergo surgically induced menopause or pharmacologically induced menopause, is that is another rapid decline in their hormones. And what we do see is that women who have to experience this do have a higher risk of Alzheimer's disease or dementia later in life. So it's especially important for these women to control all the other factors that are at play. So making sure that they're exercising regularly, making sure they're getting enough sleep, making sure their blood pressure is under control. Blood pressure starts to increase after menopause, making sure their cholesterol levels are under control. Again, another thing that starts to increase after we hit menopause. All these things are extremely important for people who, for one reason or another, can't do one of these important factors for their brain, in this case, use hormones.
And when you talk about exercise, because, you say this, Peter says this, Thais says this, it is something that everyone can do that is preventative for multiple things for women. But is exercise, I take a dance class once a week because that's good for my brain as well as my body. I do weightlifting. I try to do a little yoga. I'll try to do it all just because I'm so concerned about my brain health. But is that the right thing to do? Is it more cardio, or does it matter? Is it, does one size fit all? Is running better than yoga? So what do you think in terms of that?
Yeah, as you said, there's no one size fits all, but I do want to highlight how important that diversity is. Everybody's body is different and what everyone needs is different. So for example, I have really low muscle mass. I don't need to be cranking out cardio all the time. I really need to work on strength training. And if I'm going to do a bunch of cardio, can't let it be at the expense of losing my muscle mass. But one blanket statement that I will say that is super important that everyone should do is dance, like you said, or do some sort of complex movement training. And the reason I am such a proponent for this is because as we were talking about changes that naturally happen to the brain with age, there are changes to other neurological systems that happen, like our peripheral nervous system. So over time, you will slowly lose the ability to feel the floor beneath you. Your peripheral nerves slowly start to deteriorate. It's more difficult. You are at much higher risk of falling because you can't feel the floor beneath you. How do you give yourself more options for movement? How do you work on your balance? Well, you have to do that when you're younger. If you don't, you're not going to be able to combat these natural changes that'll occur during aging. So I'm really, really strong on making sure people work on their balance. And dance is a really, really great one because it involves cognitive training, you actually processing the visual cues that are in front of you and actually reenacting it, which is double good for your brain. So A+ for you.
You could come with me to my dance class next time. I'm really good at it.
The only other thing I was going to say is keeping your brain active is also as important. They always say learn a new instrument in music or learn a new language as you get older. Is that true? Because as you exercise your body, you should also exercise your brain. Does that make a difference?
Yeah. So there's this whole concept of cognitive reserve. And one thing I also didn't mention about aging in the brain is not all things are bad. So as we get older, we accumulate more experiences, we accumulate more education. That's really important. We get wiser, as it should be said. And what that means is we're building more cognitive reserve. So when we look at studies, what we know is that people who have a higher level of education, who have cognitively demanding jobs, who are socially engaged, who do novel activities like go to museums, take adult education classes, practice art, things that are really giving novelty to the brain are ways to promote cognitive reserve. And what I mean by cognitive reserve is your brain's ability to resist these changes that occur during aging, but also with Alzheimer's disease. You can accumulate a lot of pathology related to Alzheimer's disease, but if you have a high cognitive reserve, you're able to suppress the actual symptoms of it, which is really one huge, huge part of prevention.
And then what about sleep? I know sleep and diet are also really important. And what about taking sleep medication? Is it more important to have a lot of sleep, or is it okay to have less sleep if you don't take the sleep medication? So where do you fall in that?
So sleep is so hard. So hard for so many people. And it's because you really have to get to the bottom of why you aren't sleeping. So for women, especially women during the perimenopausal period, that can drastically impact their sleep. Progesterone, I don't need to tell you this, Dr. A, progesterone can really dramatically help women. And specifically, at least from my experience, I hear it really helps their sleep. But what is keeping someone up at night? Is it hormonal changes? Is it that they're ruminating about what has happened during the day? Like they can't turn off their brain. They're just going over their to-do list over and over and over again. Is it that they have poor sleep hygiene? They're working on a screen right before bedtime. They're eating too close to bedtime. They're drinking caffeine at 8 p.m. Like, what is the issue with your sleep? So that's my question to everyone when they come in and tell me, like, I can't sleep, before I start to say, okay, well, what medications or what strategies should we use to help you sleep better? If after everything, you cleaned up your sleep hygiene, you corrected all the things, you're not ruminating, you just are a poor sleeper, you're just waking up in the middle of the night for no good reason, which happens to some people, what can you do about it? There are definitely some supplements that have some efficacy. Ashwagandha is one of them. Magnesium threonate is another one of them. I don't really advocate for prolonged use of melatonin because high levels can start to interfere with hormonal signaling, but in the right person at the right time, it might be appropriate. I avoid at all costs over-the-counter sleep aids. So things like Tylenol PM, Benadryl, Unisum, and then prescription medications like Ambien and Xanax, no bueno for long-term brain health. Might be helpful in the short term, but pretty much you're just knocking yourself out and you're not actually getting quality sleep. You're not getting the sleep architecture that you need to protect your brain from these abnormal proteins that are accumulating in these diseases.
And you said that 10% of dementia diagnosis could be resulted from these medications. That's what I saw. Is that true?
Up to 10% is what one study said, yes.
Oh, up to 10%. So those really are not good for you long term.
Not good.
And, as a gynecologist, commonly we hear about sleep. A majority of my patients, especially through menopause, I would say anxiety is a big, big part of it. Anxious patients always wake up. So if you can't find, if you can't treat it, I always look at an underlying anxiety disorder. I personally take magnesium at night. It does work. I don't know if you've tried it. I take magnesium glycinate and I take about 400 milligram at bedtime. It really calms your nerves and helps you go into a deeper sleep. I think exercising, just like you said, there are a lot of things, but I want to make sure that a lot of my anxious patients come back and they say, well, nothing's working. And that's why sometimes when you give them hormones and their nerves calm down, they start sleeping.
Well, and what about, because I'll tell you what relaxes me is a big glass of red wine.
No.
What about alcohol in the brain? I know the answer to this, but I've got to ask the question.
So, I have to say I am torn on this. Not about using alcohol to sleep, like that's a no bueno. It's changing how much deep sleep you're getting. It's changing how much REM sleep you're getting. It's essentially the same thing as taking a Tylenol PM. You are knocking yourself out, but you're not getting that quality restorative sleep that you need. But when it comes to alcohol use and long-term brain health, you'll read so many conflicting studies that say, moderate wine consumption in the Mediterranean diet is actually beneficial to the brain. And then you'll hear other podcasters that'll directly say any sort of alcohol is directly toxic to the brain. So how do we overcome, or how do we make sense of this conflicting message? And really what I think it comes down to is the way that you're drinking. So there's a difference between getting pleasure and getting an enjoyment out of it, getting like a real satisfaction. So if you're seeking pleasure from alcohol, if you're drinking it alone on your couch, like you're not engaging with other human beings. You aren't doing it in a social setting. If you are drinking in a social setting with friends and you're laughing and you're conversing, that social aspect of drinking, I believe, is beneficial. So if you're moderately using alcohol, you're not using it right before bedtime, and you're using it in a social setting, obviously with restriction, I don't think it's so bad for you collectively, for your health and for your brain.
Do you ever feel like you just can't get all your veggies in your diet? I know I'm not alone in feeling like I'm constantly rushing from one task to the next with hardly any time to make sure I'm eating balanced meals. I first gave AG1 a try because I kept hearing about it from Dr. A. She's so busy with her patients, she doesn't always have the time to exercise the way she should. So she says when she drinks AG1, she feels super healthy and less stressed about not having the time to work out. With AG1, I love that I don't have to worry about what I'm putting in my body when I'm on the go. And that is because AG1 is a foundational nutritional supplement that delivers daily nutrients and gut health support. It's backed by multiple research studies, so you can trust what you're putting in your body. And I love that AG1 has prebiotics, probiotics, and digestive enzymes for gut support. There's nothing worse than feeling bloated. And ever since I started taking AG1, I noticed a huge difference. Sometimes I feel like I'm always bloated, whether I eat a big meal or a small meal. And AG1 has been known to alleviate bloating, promote digestive regularity, and aid in digestive comfort. If I had to recommend one product to support whole body health, it's AG1, and that's why I'm excited to welcome them as a new partner. It's easy and satisfying to start your journey with AG1. Try AG1 and get a free 1-year supply of vitamin D3, K2, and 5 free AG1 travel packs with your first purchase at drinkag1.com/SHEMD. That's drinkag1.com/SHEMD. Check it out. It's finally summer. I wish I could spend every day at the beach. There's truly nothing better than the smell of a fresh ocean breeze on a hot summer day. But recently, I've been using Osea's Undaria algae body oil that brings that feeling right into my daily routine. And y'all, I'm honestly obsessed. Not only does it smell like summer in a bottle, but it's also clinically proven to instantly improve skin elasticity and deeply moisturize. And I love knowing that Osea's products are clean, vegan, cruelty-free, and climate neutral certified. I use it every time I get out of the shower, and it always leaves my skin feeling silky and soft. Dr. A and I created SHEMD to empower women. And I absolutely love that Osea is a woman-founded and led company that has been making seaweed-infused skincare for over 25 years. Get healthy, glowing skin for summer with clean, vegan skin and body care from Osea. Get 10% off your first order site-wide with code SHEMD at OseaMalibu.com. You'll get free samples with every order and free shipping on orders over $60. Head to OseaMalibu.com and use code SHEMD for 10% off.
Can I ask you a question? At the beginning of the podcast, you mentioned that some patients have these white spots on their MRI. I actually see that commonly on patients who have cognitive issues. I send them to a neurologist. They do blood tests. They do MRI, MRA of the brain, and then they see these white spots. If you see those, and sometimes you see them in healthy patients who are not overweight, normal blood pressure, cholesterol's normal, they're not diabetic. So where are these little white spots coming from? And when you see those white spots on MRI, what do you do about it?
Yeah, let's talk about this. I think this topic is so dismissed by so many doctors. So you'll read on your reports when you get it back, like, oh, these are benign or age-related white spots in the brain. Okay, yes, they are age-related, meaning they do increase in number as people get older, but they don't happen in everyone, and they aren't necessarily benign. In fact, we do know that the more white spots someone has in their brain, the higher likelihood they are to experience cognitive decline and dementia later in life. So they're not benign. What causes these white spots? So these white spots are occurring in the white matter of the brain. What is the white matter? It is the coating of the nerve cells. So that insulation that's helping the messages signal effectively from brain cell to brain cell. It's damage to that, which is why it can result in slower processing. You're damaging the insulation. What is causing this damage? So in young women, one common culprit is actually migraines. We are understanding the pathophysiology of migraines a little bit better, and we understand that there's a huge vascular component to them. So migraines is common. Head injuries, if you've ever had a concussion, that can lead to these white spots in the brain. And then with age, what we most commonly blame are things like high blood pressure, high cholesterol, insulin resistance or diabetes, pre-diabetes. Those are the big ones.
That's so interesting. Is there a certain number of these spots that beyond that it becomes concerning? Like if you have 3 or less, you're okay?
So no, and that's because it all goes down to what your cognitive reserve is. How much can you withstand damage to your brain before having symptoms of it? If you have a really high cognitive reserve, you could have a lot of white spots in your brain and have absolutely no symptoms of it.
Bravo. And one last question for now. What about general anesthesia? There's so many patients who undergo these long surgeries, even whether it's a facelift or heart surgery, and they're under anesthesia for many hours. There's some of them who will require blood transfusion. Does that have an effect on the long term?
I believe that it does.
It does.
The studies on it and the hard data is really not so great, but inhaled anesthetics seem to be the main problem. So the things that you're getting when you undergo general anesthesia. And from my clinical observation, I can't tell you how many times I've heard the story that my mom was okay until she went in for her knee operation or her hip replacement, and then symptoms started. Same thing goes for My mom was okay until she fell down the stairs and hit her head, and then symptoms started. There's something that happens with these anesthetics, whether it's directly related to the anesthesia or the stress of this prolonged surgery. Same thing, stress of that head injury that seems to trigger the neurodegenerative process or accelerate it.
Well, that is terrible. I love going under. It's the best sleep I've ever had. You wake up from a colonoscopy and I'm like, whoa, that was amazing.
Colonoscopies are different though. Let's not scare anyone. You should all get colonoscopies. That's not general anesthesia. We will work on Mary Alice's sleep because this is a problem.
Let me ask you, what about are certain medications associated with memory loss? I know for a fact that tamoxifen, which is a common medication used on breast cancer patients, a lot of women don't take it because of the memory issue that comes with the tamoxifen.
So as you know, it's so difficult to study these things, but I'll give you one example that has been in the media a lot lately. Proton pump inhibitors. So things like Prilosec, things you can buy over the counter that you use for indigestion. These medications should really be used for short term. So for 2 weeks, at most a month for indigestion. Some people use them for their entire lives, for years and years, because they struggle with indigestion related to their diet, or they have weak esophageal tone and they get a lot of reflux. Studies are swinging, the pendulum swings to point that they probably aren't good for your cognition long-term. They're also not good for your bone health. So for women, I really try to avoid using them if you can. There are certain instances when you can't. And, this is one of those situations where if you have a unique situation where you can't get off of this medication or you can't be on hormone replacement, you just have to make sure you're checking off all those other risk factors that you can do something about.
And is it reversible? Like if you take tamoxifen for 5 years or 10 years and it affects your memory, when you come off of it, is your memory restored or does it stay down? The reason I'm asking is because so many women with breast cancer take this, no one talks about it. I had to switch off of tamoxifen. I mean, I'm an active physician and I would go to work, I would call my neurologist. I'm like, something's really, really wrong with me, but I can't stay on this. I can't even remember who I just saw. So I immediately stopped it and switched to a different medication. So and it got better. For me, it got better, but it was very short term. So for patients who stay on it, let's say for 5 years, and when they come off of it, is there an improvement?
So I don't specifically know about tamoxifen, but I do know part of my training was in neuro-oncology. So I worked at Memorial Sloan Kettering. I saw a lot of, quote, chemo brain.
Yes.
And what I will say is that chemo brain can result in these little white spots. It can cause damage. So there can be some lasting impact in terms of your attention, in terms of your processing speed. It probably matters the age at which you were exposed to it. Younger brains are more resilient than older brains, but a large part of it seems to resolve once stopping the chemotherapy. However, there are patients that it seems to have a lasting impact on them, unfortunately.
And I think that's why it's so important to do these things that you're talking about, is to have the right diet, have the right sleep, exercise, learn a language, take a dance class, these things that really everyone can do. And when you talk about, it's been said in the media a lot that Alzheimer's is type 3 diabetes. It's this idea. Can you talk a little bit about that? And if that is true, then should everyone be on these, Ozempic, Mounjaro, metformin, these medications that bring your blood your sugar, insulin, your blood sugar down? Can you talk a little bit about that and what your thoughts are?
I personally don't view Alzheimer's disease as a type 3 diabetes of the brain, but where this idea comes from is that there are changes in the way glucose or sugar is metabolized in the brain that occur in diseases like Alzheimer's disease. They also occur in other neurodegenerative diseases like Lewy body. It depends on what part of the brain this dysmetabolism is happening. Should everybody be on a medication like Ozempic or semaglutide or metformin or supplements like berberine to help them regulate their blood sugar? My answer to that is no. You should really figure out if you have underlying insulin resistance and understand that just because, and this is no fault of your primary care doctor or any doctor, but just please understand that if someone tells you that your blood sugar is completely normal, your hemoglobin A1C is completely normal because it's under 6, like, that isn't necessarily the best test. And that doesn't necessarily mean that you don't have early signs of insulin resistance or glucose intolerance. You do have to look at fasting insulin levels. You have to look at your fasting glucose levels. And for some people, this erratic blood sugar control could occur irregularly. So things like using continuous glucose monitors could be really important to understand how your diet's impacting your blood sugars and how long it's taking your body to break down those blood sugar spikes as they happen. It's interesting, and out of all of the medications you mentioned, I'll put a plug in for Ozempic, and not because I think that everyone should be on it, but because it is being studied in a clinical trial right now. It's thought to improve inflammation in the brain and help improve the way that nerve cells communicate with each other. So that's being specifically studied. And it's being specifically studied in people who carry a gene called apolipoprotein E4, which we can probably talk more about because I'm sure it's a hot topic.
Both of us have it. We both have it. So we both have one. We talked about this before you came. And with HRT, I wanted to swing back to that real quick before we went on and talked about ApoE4, because that's really important to talk about. You talked about it, doing hormone replacement in perimenopause. When do you think women should stay on it for the rest of their lives? Do you think, like, where do you kind of fall into that? Because there is so much, and we're going to do a whole podcast on HRT, but there's so much conflicting information out there. And so I'm just asking you from the standpoint of brain health, what is it that you think?
I can tell you from the data that when to start it, it doesn't seem like it has very much positive benefit in terms of brain health if you wait beyond 7 years after menopause and start it. So does that mean that we should stop it if it's been 7 years? I don't think we have a clear answer on that. So I'm going to defer to Dr. A. That's what I usually do. I defer to the OBs and the gynecologists to help guide this because I'm a brain doctor. I can't own every part of the female body.
It's true. And, I might have 10 patients come to my office and I would let 4 of them go on hormone replacement. Patients have risk factors. If they have high blood pressure and they're in their 70s, I usually don't give them hormones. If they have history of blood clots, if they've had breast cancer. So every patient is different. And just like you said, if they're very low risk and they take it and they're doing well on it, great. If they have absolutely no symptoms, they're doing it for brain health, then I would probably stop it at some point.
It's so important for physicians to be able to collaborate like this. Yeah. It's so meaningful to have a discussion as a neurologist with a gynecologist and actually meaningfully think about the person in front of you and think about, like, is this person a good candidate for HRT? And unfortunately, these conversations don't happen enough. And this is why I think we need a field of preventive neurology to be able to be that quarterback for patients who are coming to you for reasons that they're trying to protect their brain and they wouldn't necessarily present to their gynecologists for that issue. So
I did a blood test, and I think Mary Alice has the same issue. We both carry one copy of the ApoE4 gene. Obviously, we don't have 2 copies, which is good. But what does that mean for someone at our age? What percentage of people have a gene mutation, first of all, for having Alzheimer's or being at risk of getting Alzheimer's? And how many genes are there? What do we do about it? Do people need to get tested? Do we test everyone? Can you elaborate on that?
First and foremost, I want to stress that your genes are not your destiny. So just knowing that you carry a copy of this ApoE4 gene is information. It's super important information because it tells us about what processes and what pathways may be affected in your brain and in your body, but it does not mean that you're going to get a neurodegenerative disease. And I think that that is so important because so many people freak out when they learn that they have this. It should empower you. It should empower you to take control of your own health because we understand what this gene is. So about 1 in every 4 people carry one copy of this gene, and it increases your risk for cardiovascular disease, as well as certain neurodegenerative diseases like Alzheimer's disease and Lewy body dementia. A little bit. And I truly believe that because we understand what this gene does, we know how to take someone off the pathway to neurodegeneration. So this gene is a cholesterol gene. So it stands for apolipoprotein E. It is involved in transporting cholesterol between neurons, which are one specific type of brain cell, and astrocytes, which are a different kind of brain cell, or vice versa, astrocytes to neurons. So as we get older, our neurons can't make their own cholesterol. The brain needs to make all of its own cholesterol. It doesn't take our cholesterol from our bloodstream and start using it. Cholesterol is not bad. Everyone thinks of it as a bad thing. It's not a bad thing. Our brain needs cholesterol to signal with neurotransmitters. It needs it to build new brain cells. So cholesterol is good for the brain. But like I said, the brain needs to make its own. It does this by having the astrocytes make it and then send it to the neurons. How it does that is it uses ApoE. So ApoE4 is less efficient at transporting cholesterol from these astrocytes to neurons. So the neurons can end up in a cholesterol deficit. The cholesterol can start to accumulate in these cells. We can't get rid of it. And when that happens, there's a lot of neuroinflammation and then neurodegeneration or death of these cells start occurring.
And what about if you have 2?
If you have 2 copies of it, that means that you don't have a completely functional ApoE. So you are at an even higher risk of getting diseases like Alzheimer's or Lewy body. But again, I want to triple underline that your genes are not your destiny. There are so many things you can do. We understand that ApoE4 carriers do not have effective DHA or this omega-3 called DHA delivery to the brain. They need higher amounts of DHA than non-carriers. We know that they're at elevated risk for peripheral high cholesterol. We know that we can treat peripheral high cholesterol with certain medications that don't impact the brain. So there are so many nuances to think about when we think about ApoE4.
So let's say one of our listeners, just like the 2 of us, have the ApoE4 mutation. How much DHA should they have in their diet?
And what do they do to get that?
It's always best to get omega-3 DHA from fatty fish. Fatty fish are tuna, salmon, mackerel, sardines. Some people, and I recommend eating at least 2 servings a week. Some people have a harder time consuming that much fish. They don't like fish, or for environmental reasons, they don't want to eat fish. I highly suggest that they take a supplement with at least 2,000 grams of DHA, which seems like a lot.
Daily?
Daily,
Okay.
Yep, which seems like a lot. And that's because when they did studies, it showed that that's how much DHA is needed to actually penetrate through the blood-brain barrier in these people. And starting it earlier, starting it younger seems to have the best impact. So if you started in your 30s, 40s, 50s, it's getting delivered to the brain. Starting it later in life, less delivery of DHA to the brain.
So interesting.
I know. And what about vitamin D?
Vitamin D is so tricky. So there aren't really a lot of good studies, but I believe that most people are vitamin D deficient, especially where I live in New York. The sun is no longer out. It's 5:30 and dark as can be, especially in the winter months. So what we do know about vitamin D is that people with higher levels of vitamin D, 40 to 50, have a lower incidence of diseases like Alzheimer's and dementia and Parkinson's disease. Does that mean that everyone should supplement vitamin D? I don't know, because people who spend a lot of time outdoors doing outdoors activities probably also have a lot of vitamin D. And is there a confounding variable there? I don't know. I do recommend, though, that women especially supplement vitamin D. It's very good for your bone health, and I believe it's good for your brain health. So making sure your levels are normal.
For breast cancer prevention, I mean, we don't have, too much data on what helps prevent breast cancer, but for sure, I always tell my patients to keep their vitamin D above 60. So if you don't know it, go to your doctor, get your blood tested. And, most of us, even in California, sunny California, are completely depleted. My vitamin D at some point was 13 because I'm always in the office. So you can take weekly vitamin D or daily vitamin D, but you can check it with your doctor.
And what foods are preventative? So we've talked about exercise is important, sleep is important, food. What should we be eating to protect? I mean, someone told me that Richard, or it might have been you, said that every morning everyone should take a spoonful of olive oil. Is that true? Is the Mediterranean diet? I heard coffee is now good for your brain. So kind of give us everything under the nutritional aspect.
Diets are so confusing, but I do have a couple of hacks. So I don't like to make general diet recommendations. There's just like so many different diet patterns, but there are some things I think are golden. Extra virgin olive oil, golden, 1 to 2 tablespoons a day, but do your research. Make sure that it is a high quality extra virgin olive oil. You don't want any of the cheaper secondary press because it's going to contain less of these healthy antioxidants in the olive oil. So do your research and invest in high quality extra virgin olive oil. Berries, super important. 2 or more servings a day. A serving is about a half of a cup. Berries, all kinds. Blueberries, strawberries, raspberries, super high in antioxidants, help combat this inflammaging process that occurs. Again, we said fatty fish, very important. I try to have people really avoid eating excessive red meat, but balance that with making sure that you're getting enough protein, especially for women. A lot of women aren't eating enough protein. And if you want to build muscle mass, which is important for aging and important for brain health long-term, you do need to consume protein either before or immediately after you do strength training. So those are kind of my Gestalt go-to, and then coffee.
So how many cups of coffee? You can really do it and it's good for you?
Yes. So up to 3 cups a day, or if you're not a coffee drinker, you can drink green tea, black tea. It's unclear if it's just the caffeine content or the other antioxidants, the polyphenols that are in coffee, that are in tea, that seem to protect the brain. I'm a proponent of at least 1 cup of caffeinated coffee if you can tolerate it, but please try to drink it before noon because your sleep's also important. And a lot of people don't realize that, like, they think that they can tolerate caffeine later in the day, but once they stop it, they realize that it actually was impacting their sleep. So really do try to keep it before noon if you can.
And I would say, as a gynecologist, if you're postmenopausal and you have 3 cups of coffee, don't come complaining that you're waking up to go pee every 2 hours at night or
Really?
it gives urgency. It gives frequency of urination. It does affect your bladder. Not only it affects your sleep, but one of the big problems, which we talk about in our menopause podcast, is urgency. So you can't hold your pee as you're running to the bathroom. So careful. I think 1 would be good for 3 for younger, but as you get older, I don't think I can do more than 1.
You become more sensitive to caffeine as you get older too. You get that jitteriness, that anxiousness. So, up to 3, everyone reacts to coffee different, caffeine differently, but up to 3, but try to drink your 1 cup a day.
Can I ask you a question? Because it's interesting to me. A lot of patients are on cholesterol medication. And you said the cholesterol in our body does not cross the brain barrier. So which medications, you said certain medications for cholesterol affect the brain and others don't. Which ones are if you know, you don't have to answer this question, obviously, but if you know the answer, we would love to hear it.
This is something I'm extremely interested in because I've heard so many patients tell me that they get brain fog when they take certain cholesterol medications. And why does that happen? So in my practice, we monitor something called desmosterol. Desmosterol is a marker for brain cholesterol synthesis. We know that desmosterol in the periphery or in the blood correlates really, really well to what's happening centrally. They did studies on this. So it turns out to be a really good marker of synthesis. There are certain medications that can cross, certain cholesterol medications that can cross the blood-brain barrier and inhibit cholesterol synthesis in the brain as well as in the intended organ, which is usually the liver. Statin medications do cross through the blood-brain barrier. It doesn't matter if they're hydrophobic or lipophilic. There are all these studies saying it mattered. It does not matter. They can all cross through the blood-brain barrier and inhibit cholesterol synthesis in the brain. And now that's not always bad. That's not always bad for someone because having too much cholesterol production in the brain is just as bad as having not enough cholesterol production in the brain. So using something like desmosterol is a really good monitor to see, is this person over-suppressed? Are we over-suppressing their cholesterol synthesis? I find that in these cases where we are over-suppressing their desmosterol, it's undetectable. These people are more likely to complain of brain fog, especially if they carry the ApoE4. So I'm really careful about how I use statin medications and who I use them in. Medications like Zetia and Repatha, new PCSK9 inhibitors, do not cross through the blood-brain barrier. So they don't inhibit cholesterol synthesis or affect cholesterol synthesis in the brain. They're generally, Zetia is not as powerful. So it can work if your cholesterol is not through the roof. Statin medications are a little bit more powerful, so it's kind of a balancing act, but I use this biomarker to really help me understand like what's happening in the brain because we don't always have all the best tools to figure that out.
And for me, what level of that biomarker is ideal in the blood? Because I'm going to start ordering it now on patients who have high cholesterol.
So it's not necessarily a level that I'm targeting. I don't want it to be undetectable.
Got it.
First and foremost. And I don't want there to be drastic changes to someone's level because that indicates to me that we quickly suppress someone's brain cholesterol, probably too quick for their brain to cope with that change. And I also go based on their cognitive test results and their symptoms and what they complain to me about.
Amazing. And is this a test that can be done at Quest Lab, for example, or LabCorp? These big labs will run it?
It's only offered through Boston Heart Labs, but there is actually a direct-to-consumer version of it called Empower DX that people can order, and it's actually sent directly to Boston Heart. They can order it on their own, and you can test their sterol levels.
Amazing.
We love that.
It's actually great because it doesn't only tell you about what's going on in the brain. It tells you if somebody is an overabsorber of cholesterol, which would mean that a medication like Zetia would work really well, or if they are an overproducer of cholesterol, which means that something like a statin would work better. It's a great way to individualize care.
I am obsessed with my dog, Whiskey. He's a Bernese mountain dog, and I swear to God, he's my favorite snuggler. He also has a tummy that can get really upset. And trust me, that is not fun to clean up. So I am super careful about what I feed him. Sundays is healthy dog food that's easy to store and serve. Most foods are one or the other. They are both. Sundays is fresh dog food made from a short list of human-grade ingredients. Sundays contains 90% meat, 10% superfoods, and 0 synthetic nutrients or artificial ingredients. Dog parents report noticeable health improvements in their pups, including softer fur, fresher breath, better poops, and more energy after switching to Sundays. Whiskey is loving Sundays, and I love that I'm feeding him the best quality dog food. Unlike other dog foods, Sunday does does not require refrigeration or preparation because of their air drying process. Just pour and serve. Every order ships right to your door, so you'll never worry about running out of dog food again. It is so easy to store and serve. Get 40% off your first order of Sundays. Go to sundaysfordogs.com/SHEMD or use code SHEMD at checkout. The best way to learn a language is through immersion. Living where the language is spoken and using it every day. I was so lucky that I got to do that. I lived in Paris twice, once in college and once when I worked at Harper's Bazaar when I was just out of college. And it really did help, even though I had a Southern accent and everybody tried to answer me back in English. But if that's not in the cards, you can still learn a language the second best way. And that's with Babbel, the science-backed language learning app that actually works. No need to pay hundreds of dollars for private tutors or waste hours on apps that don't really help you speak the language. Babbel's quick 10-minute lessons are handcrafted by over 200 language experts to help you start speaking a new language in as little as 3 weeks. What I love about Babbel is that it's designed by real people for real conversations. The tips and tools are approachable, accessible, and rooted in real-life situations. I started using Babbel because my French seems non-existent now. And with Babbel, I can really brush up on it. It's been fantastic. Je parle français un petit peu. I still have my Southern accent, but with Babbel, it's getting a little bit better. It's so easy to learn how to order food and ask for basic things like directions without having to constantly check a language app while on vacation. Here is a special limited time deal for our listeners. Right now, get up to 60% off your Babbel subscription and only at babbel.com/SHEMD. That's babbel.com/SHEMD, spelled BABBEL.com/SHEMD. Rules and restrictions may apply. Can we talk a little bit more about biomarker testing? You were just talking, I know that's something that you and Dr. Isaacson have been working on. Can you tell everybody what you've been doing? There's so many, even the last time I saw you, there's all of these, things coming out in the media about these new tests, and kind of, it makes me hopeful, honestly.
Up until the last 2 or 3 years, we have not had very good ways to diagnose diseases like Alzheimer's. We've relied primarily on things like amyloid PET scans, which are expensive, often not covered by insurance, and expose you to radiation. Or we torture people with lumbar punctures, or we stick a little needle in their back and collect spinal fluid and test for these proteins. Before I get into these blood tests, I do want to rewind and say that I'm sure a lot of people listening to this podcast heard the news about 1.5 years ago that really raised questions about this amyloid hypothesis of Alzheimer's disease. There was this Science magazine article, and it showed that this seminal paper published in 2006 out of Vanderbilt University had fabricated images that sent shockwaves through the whole field of Alzheimer's, and everyone was questioning whether or not amyloid was causative of Alzheimer's. This, of course, came after we approved the first ever anti-amyloid therapy for Alzheimer's disease called aducanumab, and that was done based on a reduction of amyloid in the brain, not a improvement in cognition. So there was a lot of drama. And if anyone has been keeping up with the science, anti-amyloid drugs aren't exactly the holy grail that the field has thought they would be. Maybe if given earlier in the disease course, they will end up being more effective, but amyloid is unlikely to be the whole picture, is the whole point of this. There are probably upstream processes that occur either related to inflammation, related to changes in glucose metabolism, related to inflammaging, et cetera, that trigger the process of amyloid accumulation. Once amyloid starts accumulating, neuroinflammation starts forming. Neuroinflammation can be tested in the form of a protein called glial fibrillary acidic protein, which is called GFAP for short. That triggers tau accumulation. Tau forms these tangles in the brain. Tau is another protein. Once tau forms, the neurodegenerative process starts forming. So why did I give you all that background? Because what these blood tests are testing, there are these direct-to-consumer blood tests now. They're testing blood levels of amyloid beta 4240. This is the amyloid that we were talking about that starts to accumulate in early Alzheimer's disease, one of the earliest signs of it. But amyloid, as I mentioned, is not sufficient to cause Alzheimer's disease. There are people with amyloid in their brain who do not have cognitive issues and do not go on to develop Alzheimer's disease. So how do we know that someone will go on to develop it? Well, we have to use other information, not only from their family history, not only from their ApoE status, but from other biomarkers like tau. So for example, tau 217 seems to correlate a lot better with cognition. We know people who have amyloid positivity in the blood plus tau 217 on the blood have a higher risk of Alzheimer's disease, have a higher risk of progressing to cognitive decline in the next couple of years. So this new direct-to-consumer test everyone's super excited about it. You don't need a doctor to order it. The problem is that this test isn't the most accurate test that's available, unfortunately. There isn't actually any validation studies on this. There's just an abstract presented. So I don't really recommend individuals seeking this out. The validated and accurate tests are all ones that need to be ordered by a physician.
We love a good at-home test. We want to give women really the options that they can take their own health journey in their hands. But right now, you recommend go to your doctor. There are tests available. Have a physician order it. But I know you and Dr. Isaacson are working on your own test. Can you tell us a little bit about that? And I'm going to take it. I am going to take it. I'm going to be another guinea pig. So we're going to have another little a moment where we come back and get the results. Maybe Dr. A is going to take it too. We're going to have to figure out what we do.
What you've done, Marielle. So we work with the University of Gothenburg in Sweden. So they developed a special laboratory technique called immunoprecipitation mass spectroscopy. This is the most accurate way to test for these proteins in the blood. Other tests like the Quest test that we were mentioning uses something called liquid chromatography mass spectroscopy. It's not as accurate as immunoprecipitation. What are we testing in your blood? So we're testing amyloid beta 4240 ratio. We're testing for various isoforms of tau protein. So tau forms these tangles. We're testing for neuroinflammation with a protein called glial fibrillary acidic protein, or GFAP. And we're testing for evidence of neurodegeneration. So with a marker called NFL, neurofilament light, not NFL like the football league. What do we do about that? And what does this tell us? So this is such an exciting part and an emerging area of the field, because what we think is that there's a point at in the disease process where the disease is reversible. How do we identify people who are in this reversible stage of the disease? Well, we need to know that they aren't at the stage of neurodegeneration yet, because once neurodegeneration occurs, I can't do anything to bring back your brain cells once they die. But I can do things to target amyloid accumulation in your brain with anti-amyloid therapies, which also help improve tau markers. And of course, tau is something that contributes to cognitive decline directly. So this is what's so important about these tests, finding out where an individual is in this disease process and what do we do based on where this person is in the disease.
What do you do? So let's say, again, asking for a friend, but let's say that somebody's test comes back and they definitely are at the beginning of this. So what can you do? Are there medications that you can take? You know, obviously, if you're doing all the right things in terms of your diet and exercise, are there medicines that you can take to slow it down?
Right now, it's not approved by the FDA, but a lot of people are using off-label anti-amyloid therapies like lecanemab, aducanumab, at these early stages in the preclinical stage of Alzheimer's disease. It's being studied in a very large clinical trial called the AHEAD 345 study, where we're actually giving these medications to people who are in the preclinical stage of Alzheimer's before cognition is affected to see, is it more effective in this stage? We've done this. We've seen patients who've been on these therapies in these early stages, and I'd say that their cognition is stable. And when we think about treating these diseases, it's kind of like when you think about treating cardiovascular disease. You don't want to wait until the cat's out of the bag. You don't want to wait until your artery is already occluded by cholesterol plaque. You have to start earlier. You have to start when these proteins are first accumulating if you're ever going to give these medications the best chance at success. But there are other things that you can do, knowing that you might have accumulation of amyloid, that are maybe more experimental, but there's evidence that they might be effective. For example, people who get frequent cold sores with the herpes virus probably should be taking prophylactic valciclovir or Valtrex to suppress viral reactivation, because what happens is this virus lives dormant in the nervous system. And every time it becomes active, it triggers neuroinflammation. That's believed to contribute to neurodegenerative disease. So suppressing frequent viral reactivation is another thing that you can do about it. And we could go on and on and on.
No, go on and on and on. Is a genital herpes the same as oral, or just oral for brain health?
Seems to be more oral based on the location.
And at what point do you start these testings? Do you start at 50? Do you start at, for women, do you start at menopause? Do you only do it if they have a family history? What is the guideline for doing these blood tests?
There are no guidelines for doing them, although the blood tests were added to the draft diagnostic criteria this past summer at the Alzheimer's Association International Conference. So they will be more widely used for diagnosis. What we're studying and what our research is most interested in is, can you use these biomarkers to individually tailor someone's regimen? So we are testing biomarkers pre and post medications like Ozempic, medications like Mounjaro, are what's happening to someone's biomarker profile. Medications like statins, we're doing it on people who are on hormone replacement. What direction are these biomarkers going in various people? In women, in people with ApoE4, we don't have all of the answers right now, but this is what we're studying. And it's so exciting to be able to finally have a biomarker that tells us what's happening in the brain.
Well, I have tons of women in my office, and I have a lab in my office, and everyone's on Mounjaro and Ozempic and hormone. So I can do all the blood tests you guys want.
I love it. It's perfect. And what's even cooler about this is that they were testing out a way to do it using finger sticks. So you won't even need a full blood draw. You can just put a couple drops on a finger stick test.
Oh, nice.
I told you, she's a total rock star. You and Richard y'all are going to change the world for brain disease. No, I'm so excited. When do you think that your test is going to be available for everyone?
So, I mean, we didn't develop this test. The test is through the University of Gothenburg in Sweden. They are our collaborators. They are so awesome. So I'm going to give them a ton of credit here. When do I think it'll be available? That's a really, really great question. I do not know, but you are a special person because you get access to it early because you're doing our research study. So that's very cool.
And are there for now, until your tests come out, there are tests available for patients who have symptoms. But if someone at my age, 53, walks into a neurologist's office tomorrow and say, can you test me for Alzheimer's? Would they do a blood test?
That's the saddest part, because right now, and this goes back to the point of why I don't really advocate for patients directly ordering any of these tests themselves. Most doctors don't even know that you can order these tests, let alone they wouldn't know what to do with the results of it. There are, of course, some doctors who have invested and studied a lot in this field and know what they're doing. And like I said, there are blood tests that they can order specifically for amyloid and tau. You can't order very reliable tests of neuroinflammation and neurodegeneration yet. Those are just research-based. But there are tests that you can order through various labs, LabCorp, other diagnostic companies that you can test for this. But would a provider know what to do with the results is the question. This is why we need a field of preventive neurology. We need more people like me around to know what to do. What do we make of these results? People like me and Richard.
I think preventative medicine, period, in all aspects. I think in this country, we wait until people are so sick and then we treat, whether it's heart disease, diabetes, Alzheimer's. So I think it's a big issue that needs to be addressed. And honestly, that's why we have this podcast. You have to empower patients to do the right thing, or to at least ask the right questions or find the right doctors.
And then what do you think about the brain gut? There's so much talk about the brain gut health. And do you take prebiotics and probiotics?
This is an especially interesting area for the field of Parkinson's because there's this prevailing thought that a lot of Parkinson's actually starts in the gut. And in Parkinson's, the abnormal protein is called alpha-synuclein. So there is this nerve that innervates all of our gut organs called the vagus nerve. And it's believed that these alpha-synuclein toxic proteins can climb up through the vagus nerve to the brain. But there's also this idea that the gut microbiome is kind of what's causing a leakiness in this gut barrier to the brain. So do I take a probiotic? I don't actually take a probiotic, but I do eat a lot of prebiotics. So I believe that eating the right diet, eating a lot of whole foods, getting a lot of flaxseed, getting a lot of chia seed, eating a lot of raw vegetables is how you kind of nurture this healthy gut microbiome. We do know that in diseases like Alzheimer's, diseases like Parkinson's, that there is dysbiosis. So there's a loss of very beneficial gut bacteria. But what we don't know is if you give there isn't really a great probiotic to give these specific bacterial colonies back to these individuals. And we don't have any clear evidence that just giving someone a regular probiotic is helping restore these abnormal dysbiosis that someone might be having.
Well, you have been amazing. We've taken up so much of your time. I'm going to ask you a few more quick questions, and then I want you to leave us with your top tips. Sauna, hot yoga, do you recommend it?
I'm a proponent of the sauna and the hot yoga. So there are heat shock proteins that are thought to be super important for the brain. Do we know exactly the right protocol for sauna use? No, but I'm a huge proponent of the sauna. I think it could be very, very beneficial for both keeping up your heart rate and for these heat shock proteins.
If you're going to take one vitamin, what would it be?
You know, I don't like giving blanket advice.
Omega-3, she said it, for the brain.
Omega-3.
Right?
Or B complex vitamin. Most people do need a B complex. They don't get enough B vitamins. And the way to test that is really looking at someone's homocysteine levels.
So test that. You can test your blood. You can see what you need and then take the vitamin. One food that you would recommend that everyone eat?
One food, berries.
Berries.
So what would you say to a gynecologist like me who sees women at all ages? I see a lot of women in their 40s and 50s. We know about the benefits of hormone replacement if started early in low-risk patients. Omega-3, we talked about diet, exercise, all of it. But what would you say to a doctor like me? How can I help my patients?
I advocate for offering ApoE4 testing for your patients. And especially as a gynecologist, I think it's super important because we know that from the studies we have, it seems like ApoE4 women are at a higher risk of the negative effects of menopause, and they may benefit most from HRT. So if there's something that can sway your decision in one way when you're thinking of like, should I put someone in HRT or shouldn't I? Maybe that ApoE4 genotype would tell you or swing you in one direction over the other.
That's amazing. Kellyanne, you really are. You're so, did I tell you that she's such
incredible.
A badass?
She's been telling me
that you got to be on the podcast today. So Kellyanne, as we leave you, I just want you to tell us your non-negotiables. These are things that everyone and every woman listening right now needs to be doing.
This is going to sound really basic, but it's not. So don't dismiss it.
I'm not going to dismiss it.
Learn about yourself and your family history. While your family members are alive, if you haven't talked to them about your family medical history, do so now. Ask them what diseases run on both sides of the family, what age do these diseases start? And it's not just about neurodegenerative diseases like Alzheimer's. It's also about mental health issues, diabetes, high cholesterol, strokes, heart disease. Cancers are also equally important, especially the primary site of the cancers. So, for example, things like melanoma can spread other places, but really start on the skin. And melanoma is related very strongly to Parkinson's disease. So really, really understand what you are at risk for, because the only way that you can do something preventive or proactive is to know what you're up against.
Patients who are anxious and depressed, chronic anxiety, chronic depression, are they at higher risk of having cognitive issues later on in life?
I believe so, but what's so tricky is that there are these prodromal symptoms of neurodegenerative diseases. So things like constipation can happen 10, 20 years before Parkinson's. Things like depression and anxiety can also be prodromal. It can happen decades before the memory symptoms happen. So the question is it triggering? Is the depression triggering the disease, or is it a manifestation, an early manifestation of the disease? The reason I think treating or the depression and anxiety truly do impact the disease is because if you're depressed and anxious, how are you going to do any of the other important things for your brain, like sleep,
Right.
like exercise, like care about your diet? So whether it's direct or indirect, it doesn't matter. I really think that mental health and emotional health should be a part of brain health.
One more question. How do you differentiate between dementia and Alzheimer's disease in a patient who's 80 years old?
So dementia is just an umbrella term. There are lots of different types of dementia. There's vascular dementia, Alzheimer's disease dementia, Lewy body dementia. So in order to really differentiate it, you have to do a clinical assessment, know what cognitive domains are affected. So for example, things like Lewy body really impact visual spatial function, whereas things like Alzheimer's disease really impact language and short-term memory. So that can give you a clue. And then certain tests like we talked about, blood tests can help us know which differentiate between various types of neurodegenerative diseases. Brain MRIs can help show if there's shrinkage in a specific part of the brain. For Alzheimer's disease, you usually see shrinkage in the temporal lobes and the parietal lobes of your brain, whereas Lewy body, you see it in the back of the brain, the occipital and the parietal lobe. Those can give you clues. And then, of course, things like PET scans, which are looking at metabolism in the brain. So lots of things that you can do to test.
Okay, one last question before you head out. You mentioned something, and this is a very personal question. Having watched my father go through Parkinson's, and I actually had them both do 23andMe to get their genetics because, just to your point, I really wanted to know. I mean, we had to take my dad's split. He has a breathing tube, a feeding tube. Like it's very difficult for him, so he couldn't do it the normal traditional way. But because I wanted to know, and Thais and I talk about this all the time with breast cancer. It's like you'd rather know so that you can do something about it because your genes aren't your destiny. And I love it when you say that. But now, do you feel like if maybe my father had gotten or we had been on it, or he had been on it, or we had one of these blood tests at this point, could we have done something to prevent him from this incredibly vibrant man who now, can't eat or sleep or talk or walk, are we better? Are we getting there in terms of being able to stop these diseases? Or are they, like you said, once it happens, there's nothing you can do?
Well, that's not true. So, for example, we know that people with Parkinson's disease who exercise have a slower disease progression than people who don't. So yes, there are things that you can do. Control your blood pressure, control your high glucose levels. Those are all things that are actually going to impact how quickly your disease progresses. So if you are diagnosed with early mild cognitive impairment, don't think that all is all doom and gloom. Like, no, you still have a lot in your power that you can do. And I've seen people have mild cognitive impairment for a decade without progressing because they were so proactive about everything that they were doing. So there is so much that you can do, and a lot is in your hands.
Okay. I think that's really hopeful and empowering for everyone listening. And I just want to Thank you again. Will you come back on again? Because we could talk to you for about 5 more hours. You're so incredible. And I'm just so thankful to have met you and that you can give your wisdom. Because, I mean, for those of you that are just listening that aren't watching the YouTube, she looks like she's 4 years old. She's the most gorgeous skin. There's not a wrinkle on her face, but you're just magnificent. And you have such a great message. So thank you so much for being here on the podcast with us today.
Thank you both. Thank you for giving me this platform to share this important message with everyone. It means so much. Thank you.
Thanks, Kit.
Thank you. Bye-bye.
For more brain health tips and resources, visit SHEMDpodcast.com. And remember, if you want to own your health, a good place to start is by following us on social media at SHEMD Podcast. Subscribe to our podcast on YouTube or wherever you get your podcasts to stay strong, healthy, and empowered.